Perfect. Well, we'll stay on the line for a little longer. If people have questions, they can feel free to chime in, but I think perhaps this has been a really wonderful sort of circle that's closed in, providing great feedback in the virtual area. So we'll stay on the line if people have questions, and we're happy to entertain them. So that's actually a very good question. So what are some challenges with recording clinical encounters? So thinking about times where we may want to review clinical encounters in the future, or thinking about times where I know in family medicine, we sometimes record our clinical encounters for later review. Has anyone done that? Has anyone used that as modality? Challenges, thoughts?
It's Joe, just from a family medicine perspective. I think during the pandemic, quite honestly, it has been more challenging because I think we as preceptors have been less familiar with using it as opposed to in office, when it would be more perhaps natural for us to do that. And so as we have been less familiar, it's just kind of another thing, and asking consent and other things of that nature. So I would say it definitely has been a challenge. It's certainly not a challenge that can't be met. I think it takes the wherewithal so that we ourselves and the residents are actually comfortable with the technology. We ask the consent. We actually, record whatever the virtual care visit is, and could do so. And in fact, it would be quite amenable to that if we had the wherewithal to remember to do it in the first place. So I would say the challenge is probably remembering to do it. But as we said before, with in-person or virtual visits, these are all quite possible with just a bit of reflection and thinking about it.
Great question in the chat. Are there any forms of literature that inform or provide guidance how to supervise or assess trainees in virtual clinics?
So I think in our resources section, we've included some of the material produced by the Royal College, and Lisa shared it earlier in her Word document that we shared, but they will be available with the resources links at the end. So the Royal College has put out guidance on how to do this effectively, and I believe the Canadian College of Family Physicians has as well. So you can definitely read those.
Yes, I was just going to mention what Haroon said, that the College of Family Physicians has similar resources published.
And in our earlier talk, which is going to be posted to the faculty development portal, where we talked about supervision in virtual care, there was a section on resources and a literature review of current best practices in literature, if you're interested in going and using that as a resource as well, looking back at previous web talks. So we've talked a little bit about some of the ways we can change our style when we're providing virtual supervision or feedback. What has struck you in each of your personal experiences as something that has come easily, or perhaps something that was more challenging than you thought it would be as you sort of jumped into that virtual world and were working with learners?
I think for me, distraction. Having to do my own patient to clinic, as well as being available for the learner, and having to be mindful of text messaging. Sometimes I can't sometimes respond immediately, but I will have to find a way to get back to it, but it stays in my mind. So I think like I need to get this done. So it's some distraction. I think that's something initially was a little bit of a challenge to overcome, and then with time, learn how to organize the schedule in a way that I know there's a gap so I can be responsive immediately.
Yeah. I think something that a lot of people have struggled with, and certainly a lot of colleagues that have not historically engaged in much, if any, virtual care pre-pandemic is the idea of managing a new workflow and being able also to provide an academic component like, trainees joining their clinics and, evaluating them and providing feedback. So it's a lot of new processes and a lot of skill development that's happened rapidly, and certainly has been somewhat overwhelming, if not challenging, for a number of people.
I'd say that a nice thing or an easy thing has been residents and many patients do this normally in other contexts and actually have been very welcoming of actually having more virtual care and the convenience on their part. So that has been great. I do echo the challenges sometimes with workflow and scheduling, as well as, I think a lot of preceptors have been kind of forced in some ways to, with some of the junior learners, to maybe trust them a bit more, because it sometimes is harder to set up some of the direct supervision and giving them more autonomy at the beginning than you were expecting. I've heard from some preceptors has been a bit of a challenge.
And just feeding off the distraction piece, I find oftentimes, because you have your computer screen on, there may be other things going, you're getting your push notifications about the emails you're receiving while you're providing the care. So sometimes turning those things off help. And I find if you have your whether you may be reviewing patients' labs and things like that, that can help you keep you focused. But also, if you're really trying to key into the assessment, having the assessment forms opened up, so that they're triggering you to look for those things in the residents. I find that helps you stay quite on task, particularly because I find I do get quite distracted when I have a computer screen on.
From my perspective, something I've found to be really, I didn't expect this to be easier in the virtual care context, but it was kind of touched on before that I think the patient is less likely to just look towards the staff or the supervisor in the virtual care context. So I find I've been able to have the opportunity to provide more counseling and discussion of the management plan than I expected that I would be able to. So that's been a great part of it, especially if when the supervisor joins the call, they say the resident is going to start with the discussion, and then I'll chip in if there's any other comments. So that really provides me with that learning opportunity. I think the more difficult thing has just of this experience has been getting used to different platforms, working with different supervisors, and trying to get a sense of how they operate their EMR and accessing all of this remotely. And once you use it for one patient encounter, it usually works pretty well. But that sort of getting used to how they generate their lab requisitions or how they order their medications and how to get that to the patient's pharmacy and all the logistics around that with different supervisors in the remote setting. That's sort of a challenge I've identified.
It's interesting because I think thinking about and hearing you say that, I wonder also about the context of setting up an educational alliance in the virtual context. So we know that when you hear feedback, you hear it in the context of that educational alliance between yourself and the learner. So as a learner, you hear it because you've got a relationship with others. And if you're both working virtually or away from each other and aren't in the same physical space, I wonder if it can sometimes be challenging to do that work that establishes that educational alliance. I wonder if people have found a creative way to establish educational alliance or do that work, that relationship building that makes that feedback that much richer in the virtual context.
I did have feedback from one of our residents about not meeting the supervisor in person before this pandemic, and trying to work on this educational alliance virtually has its limitations. He provided a very good example. He's like, I didn't know this learner before the pandemic and we did work together. So he thought, I know when you move or when you look at me that I'm either too late or I need to change my tact. He said, but in the virtual environment, I did not have that ability to see what you're looking like because you're listening to me without me seeing you. So I think that was some of the challenges. But the advantage as well, I found learners are really amazing and very skilled in writing their notes I'm seeing their notes live, and it's really amazing. How can I be able to see what they're saying and what they're writing, and I can able to give them feedback really immediately to say, great plan, this is great, maybe we need to specify who's going to do what out of this plan. So that's another advantage I found.
Perfect. And Teresa's just reminding us as well that when we are thinking about our junior learners, there is a VPC event coming up in August that people can register for, and they should mark it in their MacPDF event calendar so that they can be sure to join that if they're thinking about setting up an educational alliance with a more junior learner as we meet our junior learners at that time. Are there any last closing thoughts or comments that anyone on the panel or anyone listening would like to make? I'd like to thank everyone for coming and joining us tonight. This has been a great conversation. I know I've learned lots. Thank you everyone for joining us tonight.